Can you walk me through the type of tests and assessment a clinical exercise physiologist does?
Sure. So we do several different kinds of questionnaires at the beginning of the program. We're looking to assess your mental health. So we do like a PHQ-9, a GAD-7 to look at your depression and your anxiety levels. We also typically will do a nutrition screening of some sort. We like to assess your sleep. And then we'll often also do some kind of functional assessment. So for us, that looks like doing a 6-minute walk test with your fitness watch.
And so I'm curious, how do you personalize programs for your patients?
So we use those assessments we start your program with to better personalize what you need. We set goals and have a one-on-one conversation about where you want to see yourself in a couple of months. And then we also take that functional assessment and better establish an exercise program that is both relevant, but then also sustainable for you.
So how do you monitor and evaluate progress to the program?
A lot of times we measure your progress by where you are in your goals. So if you've met your goals, great, we're going to set new ones. If you haven't, what are those barriers or why haven't we gotten there? And walk through what those barriers are. So we'll take the time to figure out what the next step is so that we're able to meet your goals. And that's the biggest way we can measure some of that progress. Otherwise, we look at your exercise progress. We look at how much exercise you're able to do, how long you're able to go, if you've been able to incorporate intervals or increase your intensities in any way.
So that's my initial assessment with you. Tell me what I can expect.
So during your initial assessment is the first time you'll see us on the video. So we'll meet, we'll kind of do an introduction, even though we'll likely have met you before over the phone. We walk through those assessments if you hadn't had a chance to complete them prior. And then we talk about your risk factors. What other things impact your ability to progress throughout the program. So whether you have high blood pressure, high cholesterol, diabetes, things like that we can also work on with education or our one-on-one meetings each week. After that, we build a treatment plan. So we look at goals for each of those risk factors. And then we also build an individualized exercise prescription that you can then implement at home.
So I'm wondering, after a heart event, how soon should I start cardiac rehabilitation?
That's a great question. So typically we want to start you moving as soon as you can. If you had a stent, we want you up and moving. As long as your doctor is okay with it in the hospital, getting up and walking is great. Now, starting cardiac rehab, typically within a couple of weeks is that sweet spot. You get home, you get familiar with your new life almost, and then you start your exercise program where we can start to progress you and push you a little bit harder. If you have heart failure, typically cardiac rehab has to wait till that 6-week mark, although that doesn't mean you can't start exercising on your own before starting with us.
Can you tell me what type of exercise I should expect during my cardiac rehab program and how are they going to benefit my heart health?
We do a wide range of exercise. We like to focus on aerobic exercise. That's what allows your heart rate to come up and stay up for that time and really help build that muscle. But we also do a lot of strength training as well. So oftentimes we'll utilize bands or we'll be able to utilize a water bottle or your body weight to be able to strengthen those muscles. And then it's also nice to focus on flexibility and balance and stability, things that will help you functionally as you age.
Right. Is there any lifestyle change that I should be making in addition to the program?
We'll guide you through some of those lifestyle changes, but a lot of times it includes your diet. So are you eating right? Are you following a cardiac diet? Are your portions right? We also focus a lot on your sleep and your stress management because those all impact the heart. So we look at multiple aspects of your health within our program to help your lifestyle in the end.
And if I'm exercising and I'm experiencing, symptoms or discomfort, what should I be doing?
It's very important to know your body. So if it's a new symptom or it's severe, we want you to stop exercise. You either need to talk to your physician or go to the emergency room, depending on how severe that is. Now, if it's something that's more chronic or it's a little more subtle, stopping exercise and being able to assess yourself. Check a blood pressure, drink some water, see if those symptoms go away. If not, again, that's when you should reach out to your physician. But if it's something like chronic stable angina, something that you have and you're aware of it, sending us a message and just letting us know that you're having that symptom so that we can keep track, just in case it trends in the wrong direction and we need to reach out to your physician at that point.
Can I still participate in cardiac rehab if I have, any other health condition?
Cardiac rehab can be very beneficial to other health conditions. It's great for your overall health. So in addition to the exercise, we're working on your diet, we're working on your sleep habits and your stress, which can help your cholesterol or your diabetes. And in the long run, potentially get rid of some of the burden of that, whether it's medications or the stress of it all. So other health conditions is not a reason to not join cardiac rehab.
Can you walk me through how cardiac rehab can help me, manage my emotions, improve my stress?
Yeah, so cardiac rehab is great for mental health. It helps you in many different aspects. So the initiation of an exercise program is going to help with the stress and mental health side of things, just in that you're releasing endorphins, you're feeling good about everything, but then we're also doing a lot of education. How can we stop stress in a moment, through breathing techniques or coping strategies that can be implemented.
So I've completed cardiac rehab and I'm wondering, what should I be doing after that to maintain my health?
Hopefully, we've implemented great lifestyle change throughout your cardiac rehab program. So the goal would be to maintain that or to continue to progress it as you get stronger. So eating right, following an exercise routine, using those coping strategies we talked about for stress management, all of that together should be continued through the rest of your life.
What's the main difference between Kento and other cardiac rehab programs?
So the biggest difference is that it's not in person. So we're gonna meet via video for your entire program, but we do a lot of the same. We talk about those exercises that you need to be doing at home. We talk about your diet, we talk about stress management. The core of the program is still based around cardiac rehab. We just meet differently, which doesn't change how you can be successful in a cardiac rehab program.
Is there any, resources or support available to me between the sessions or after the program ends?
We want you to feel as supported as possible, so there's so many resources out there for you. Within the app itself, you have the Kento library. You're able to go through and read about any condition, anything that we've talked about during our sessions. You also have the availability to chat with us at any time. So within the app, you can send a message and one of us coaches will be able to answer hopefully that same day and get back to you with anything that you need.
So I imagine my rehabilitation journey is not a straight line, so there are probably going to be setbacks, and I was wondering, how do I handle them? What would you recommend?
It's important to know that setbacks are normal. They're completely normal, so that's okay. You got to take that step back and look at what is impacting your setback and talk with your coach. We can talk through those barriers and get you back on track. Recognizing what the issue is really going to help you in the long run. And even if it's not your fault, if it's something that is out of your control, like a health condition, we can take those steps slowly to get you back to where you need to be.
Can you tell me how hard I can push at home? Because I'm not always sure how intense should I be going.
That's a great question. We get that all the time. So that intensity is very dependent on where you were at the beginning of the program when we completed those assessments. But a lot of times we start out by saying moderate intensity. So something where you can push yourself to the point where you're feeling like you're working out, but you can still maybe have a conversation. So that moderate intensity. Now, if you are feeling good and you're wanting to do more, there's different things you can do to progress. So you can increase your time, you can go a little faster, bring that heart rate up just a little bit more, but that's something that you can talk with your coach about if you're ready for that next step.
So how much exercise should I be doing every week to strengthen my heart?
Yeah, so when you are working on strengthening your heart, the goal is 150 minutes of moderate intensity a week. Now, you can also do 75 minutes of vigorous intensity instead. Either or is going to help with that heart.
I was wondering if all the exercise I'm doing will help me reduce the amount of medication that I'm taking currently.
We will see patients often be able to reduce their medication burden. That exercise improves your blood pressure, it improves your blood sugar, it improves your blood cholesterol. So by bringing those levels down, you may not need as high of a medication dose to manage it, or some people are able to get rid of those medications altogether. It kind of depends on a conversation you have with your provider and where those levels truly get.
I'm wondering how I can progress my exercise routine safely.
So you know your body the best. That's the easy answer. So you're gonna know when you're ready to progress. But if you're looking at your exercise routine specifically, you can progress it many different ways. You can increase your time. So if you were exercising in 2 10-minute blocks of time throughout the day, you can maybe do 2 12-minute blocks. You know, the goal is 30 minutes a day. So working towards that 30 minutes is what we really want to shoot for, at least initially. But if we're now going 60 minutes of exercise, we need to maybe bump up your intensity. So you can go faster, you can incorporate intervals into your program. You can do different things like that just to increase that intensity and progress a little bit. But it's a good conversation to have with your coach if you're not sure what those next steps would be.
So while I'm exercising at home, Is there any symptom that I should be watching out for?
Yeah, so those symptoms can vary, but the biggest things to watch out for would be shortness of breath, extreme shortness of breath, dizziness or lightheadedness. If you're having any chest pain that maybe radiates into the neck or down the arm, even into the upper back sometimes as well. Palpitations would be another one to watch out for. And a lot of times those are symptoms that you need to sit and rest. And if they don't go away, that's when it can be a concern. But with rest and they go away and resolve, that's a good sign, but still worth mentioning to either your physician or sending a message to us as coaches.